Cancer Awareness Month, and joining me once again in studio, Diane Koster. Good to see you again, Diane.
Good to see you too.
So October, Breast Cancer Awareness Month. It's been this month for a number of years. What do the women need to know?
Well, men and women really do need to know that your risk is higher if you have a family history of breast cancer. Anybody can get breast cancer even if you don't have a family history. You need to watch for changes in your breasts, any type of rash, redness, enlargement, any changes. That can be an indicator of something going on inside. What's really important is that women get their screening exams done in a timely manner. And the guideline is that you start screening for breast cancer at age 40. Now, the exception to that is that if you do have a family history or if you're showing any types of signs or symptoms, like the ones I mentioned, and, talk to your doctor and be your own advocate and make sure that if there's something you're concerned about, you get it checked. Because if it's caught early, it can be completely taken care of. You can be cured. You can live a long and healthy life. On the other hand, getting a screening even before you have any signs or symptoms, there can be things going on inside of your body that you don't know about, and you may not have any outward signs or symptoms, but there could be something starting. So that is the importance of the screening process. They can catch something early on the high definition mammograms and do ultrasounds or other testing for diagnosis if needed. And so don't wait to put off the screening even if you're not having any signs or symptoms.
Now, you mentioned men and women, the men primarily for support, but men can also get breast cancer, right?
Absolutely. The statistics are low, but boy, it can happen. And it's just as devastating, and it can be caught in later stages because a man maybe isn't really paying attention or could write off a symptom to something else. Yeah. But definitely much lower percentage of men get breast cancer, but it does happen.
Yeah, we're visiting with Diane Koster. Now, you mentioned, the examinations, and I know the technology has really improved greatly for determining whether or not there is breast cancer available. At the...
Yes, anything may be caught in earlier stages that it might be hard to see. Nowadays, most imaging facilities, especially here in our area, do the 3D high definition mammograms. At all of our Genesis facilities, that's all we have. And at Jackson County Hospital, we are a Genesis facility, as well as the Genesis in DeWitt. So if you're going to a facility that maybe doesn't have the high definition or 3D mammography, I would definitely look at going somewhere else that might be in our region that would be offering that. We pay for those through our voucher program if you can't afford it. If you're in a situation financially where you're struggling to get by every month, whether or not you have insurance, we'd like you to reach out to our program and we can screen you over the phone for eligibility.
So how can people get in touch with you, Diane?
The best way to get in touch with my program is through my direct phone number, which is 563-421-3081. And I can have that conversation with you and talk about, I only ask two simple questions, and that's how many people live in your household and what is your monthly or annual income after taxes. And it's a very generous guideline. It really is. It surprises me that a lot of people who think they don't fall into the category or feel like they might not be eligible based on their income really are. So don't hesitate if you have a concern and if you need help paying for your breast imaging.
Okay, again, if you could give us that phone number one more time, and if there is a website that people can go to.
There is. The phone number direct to my desk is 563-421-3081. That's in Davenport, but I cover this entire region. And if you want to learn more about our program, Care for Yourself, you can go to the Iowa Department of Public Health website and type in Care for Yourself or CFY.
All right. Now, you are again in Davenport, but you cover quite an area. How did you fall into this particular line of work here?
Well, it was a journey. I do have a radiology background, but about 7 years ago, my 28-year-old daughter had some symptoms of breast issues, and she did end up getting diagnosed with inflammatory breast cancer, which doesn't present as a lump. It was more of a rash and a swelling and a warmth to the breast, almost like a mastitis. So she put off getting it checked because they thought it was just a bug bite or an infection of some sort. It can mimic mastitis. So she did end up getting a breast ultrasound, which our program can also pay for if you need it to have that diagnosis. And they did find a very rare type of breast cancer called inflammatory breast cancer. She ended up passing away very quickly. And so now this really is my passion to be here educating and to make sure everybody knows there are programs available to help pay for your imaging.
Okay, no doubt a personal touch for you. Again, thank you so much for coming in. I know you had to race up here from Davenport. Hope you didn't break any speed limits. No. Okay. What is that phone number one more time, Diane?
563-421-3081.
All right, thank you so much.
Thank you.
It's a bird! It's a plane!
The Dan Patrick Show.
Dan Patrick. Yeah!
There were a couple of things in there that people are going to gloss over. Nobody was asking Patrick Mahomes about his ankle after the game. They asked him 3 questions, I think, about Taylor Swift.